My name's Liz. I graduated from the MIPH program here at Sydney in 2009, and I've just come back from spending a year in Bangladesh on the AusAid-funded AVID volunteer program. I was a nutrition research and evaluation officer with WorldFish. WorldFish is an international agricultural research organisation. They do research and development interventions. They're funded by international bilateral partners, and I spent most of my time working on a project funded by the International Fund for Agricultural Development, or IFAD. And it was a project which focused on small fish and nutrition, and it was sort of the first time that WorldFish, as a mainly agricultural organisation, or aquaculture even, had sort of started incorporating nutrition into their projects. This is sort of crossover between agriculture and nutrition is a new, and not a new thing, but it's very much the focus of funding in the nutrition field at the moment. So I was really lucky that I got to work on such a kind of in-the-moment project, and it was really interesting. WorldFish is part of a CGIAR collaborative, which is a consortium of 15 agricultural research organisations. They all have a similar mandate to reduce rural poverty, improve livelihoods, and improve human health and nutrition through agricultural methods. There's organisations like WorldFish. We focused on fish. There's the International Livestock Research Institute, Rice Research. Anyway, there's a whole bunch of them, and they all do similar stuff. So, as I said, I worked on the IFAD Small Fish and Nutrition Project, which was what? So I'm just going to present on some of the research I did related to this project. So there we go. So the project worked in 2,000 households in 3 different districts in Bangladesh, 2 in the northeastern district, which I've highlighted here, so in Dinajpur and Rangpur, and 1 in the northeast in Sunamganj. We worked in 15 households in the 2 in the northwest and 500 in the northeast. The northeast was initially thought of as a control, but once they realised that the situation was so different, it was sort of just used as an alternate intervention. So there's the figures on the screen, and we worked with a mixed group of communities, Hindu, Muslim, and Adivasi, which are the indigenous communities in Bangladesh. And the note at the bottom is about the Hawa region, which is quite different. So in the first two districts, we worked with household ponds. There's about 4.2 million household ponds in Bangladesh. People use them for small-scale fishing activities. They might use them for nothing, and they're not really used for commercial purposes. And in the northeast, we worked in the Hawa region. The Hawa is a wetland area that in the rainy season is full of water. It sort of looks like an inland sea, and then as it dries out over the course of the year, the water levels get lower and lower until the water just remains in these small sort of lakes. So it's sort of the diversity and the seasonality, the fishing and the patterns changes over the course of the year on the basis of how much water is in the areas. So the project had 3 main objectives. I've only included one here, which is the one specific to nutrition, which I think is probably of interest to anyone who's tuning in online. So the overall goal was to increase household income in poor rural households and improve nutrition, particularly of women and children. And women and children were the main targeted beneficiaries of the project through selection of households and through the nutrition counselling and inputs that they put in. The project started before I got there, so I came in after 18 months. And yeah, so what they did was the main focus of the project was technical assistance provided to the household farmers and then the communities in the Hawas to improve their fishing and to adopt a new technique which was referred to as polyculture. So instead of just sort of having a traditional system where they had one fish or one sort of type of species, they have large fish and small fish, that they adopted this program where they would include another type of small fish in the pond. And the small fish, the focus of this one, there's 2 of them. They're very rich in micronutrients. If you consume 20 grams a day of this one particular fish called mola, you would meet all your vitamin A requirements. And if you had the same amount of another fish called darkina, you'd be getting nearly all your zinc and a lot of iron from that as well. So one of the ideas behind this project is if you can increase people's consumption of these particular small fish, then you're going to increase their micronutrient health. And also fish is a great source of protein. These are some of the types of fish. And I guess I go back to a point, why fish and nutrition? Well, in Bangladesh, fish is the main source of animal protein in the diet. on average in the rural areas is about 45 grams a day of consumption, which doesn't sound like a lot, but in terms of a plate size, it is quite a lot. It's the third most consumed food after rice and vegetables. So fish really in Bangladesh in particular is a really, really important source of food in the diet. So you can kind of understand the role it might play in the diet there. So in the project, as I said, had a lot of technical components where our WorldFish field staff would work with household communities to improve the pond management, help them stock the pond, encourage them to maintain the different species, and sort of encourage them to improve their services, and then talk to them over the year about sale and problems that were arising. So it was very much an agricultural technical program. And then there was a nutrition component that was delivered through lead farmers who were selected from the communities and trained by Helen Keller International, one of our partner organisations, and they provided the training to the lead farmers, and they were trained in sort of basic counselling, nutrition care, nutrition advice. So they would visit the women in the communities and also the men and talk to them in sort of informal sort of sessions and encourage them to to feed their children, and not just about nutrition. I mean, not just about fish and not just about nutrition, but the key messages were that fish is a really nutritious part of the diet. When you're pregnant and lactating, it's a really essential thing because it can provide so much protein and micronutrients. Talking to women about a balanced diet. So I mean, it was a very kind of comprehensive nutrition training that these women were given, and the idea was that then they would then go and pass on the advice in the communities. They did cooking demonstrations, which utilised sort of new recipes with the fish that were sort of popularly known but not popularly consumed because they're expensive in the market now, and they hadn't really traditionally been grown in ponds for a long time. Sort of in the last 50 years, what was being stocked in the ponds had sort of changed. So it was sort of encouraging women and mothers-in-law that you can use this fish and you can use it in this way, and trying to encourage women to do it and encouraging them to have an understanding about the role of fish in the diet. And then the other sort of element of the nutrition, the evaluation part was that they did monthly food consumption surveys just to sort of track what people were eating. So that was sort of the nutrition component of the program. The project had sort of ongoing process evaluation. They monitored production, costs to the farmers, how much they sold, how much they gifted into the community, and including the food consumption surveys that I mentioned. Unfortunately, the food consumption surveys were a little bit hard to, there was some slight problems with the collection, so we weren't really able to understand, as we were coming to the end of it, what the differences had been in terms of fish consumption from the beginning, and what was going on in the household. And that, obviously, given that we want to target the women and the children, we really wanted to get a better idea of what was going on inside households and what their preferences were. So my supervisor and myself and the project coordinator decided to run some qualitative activities. So I spent most of my year in Bangladesh sort of, first of all, designing the surveys and the tools, and then running them, and then writing up our findings. So I'm going to share with you a few of the things we found, so hopefully they're a little bit interesting for you guys. So the main purpose of the qualitative activities, as I mentioned, was to sort of better understand the impact and effect of the Small Fish and Nutrition Project, especially how it related to the project elements. Particularly wanted to see how the lead farmers had been utilised and whether they'd been effective. We wanted to understand what drives household consumption of fish and vegetables. There's a lot of, when you're in country, you have a lot of, I certainly, as a non-Bangla person, had a lot of ideas about how I thought that, maybe people would make choices. And I think, sometimes the people who are writing the programs as well, we thought one thing, and then we found out when you get there that actually, what we thought wasn't really what's driving what goes on in a household, which is, is quite obvious. But it was interesting to, see what came out. We wanted to know about family dynamics and household decision making, which is, really important in a context like Bangladesh, and to just look at, we wanted to establish what our consumption data that was sort of collected quantitatively was saying, and we were able to really, to get some good ideas on that. So what we did was we did 2 rounds of data collection. The first was we did a participatory rural appraisal techniques where we went into the communities and we invited everyone around and we asked them. We just did these things called ranking and purchasing matrices where people would come and sit around. I think I have some photos somewhere else. And we got so good picture about seasonality and what people were growing and what they were selling and what they ate and what they liked to eat and what they knew. And then we use that to then design survey questions for focus group discussions and semi-structured interviews. So we did the first round in late October and November. We went to each area and met about 3 communities. In each project district, met about 3 communities. And then in February and March of this year, we returned to the districts, but not the same areas, and conducted focus groups and semi-structured interviews. We targeted, for the focus groups, we wanted to get a diverse picture. So we looked at mothers. We picked mothers groups for mothers of children under 2 who were both, and we had separated the Muslim communities to the Hindu because their practices are quite different. Mothers-in-law, because mothers-in-law have a very important role in a Bangladeshi household in terms of like food and beliefs and practices and, encouraging women, in healthcare. We spoke to the male farmers to see what they felt about the project. And then we spoke to lead farmers. And then in one instance, we spoke to the Adivasi community, the indigenous group, who was only one, who just had one communal pond. So we did that. And then we did the semi-structured interview. We did about 10 in each with mothers, again, with children under 2. And the mothers hadn't been participants of the focus groups, so we sort of didn't take too much people's time. So these were the objectives. I'll just sort of go through some of our basic findings compared to each objective. So the first one we looked at is seasonal changes and how that affects what people eat. So we found that there was I'll look at the picture so you don't have to look at the text. So we found that in comparison to the dry season, the small fish, which is the real focus of the project, and increasing that consumption was much higher in the rainy season. And that's because these ponds, this is one of the ponds with the netting team, there's much more water, and there's a lot more water around, as you can imagine, in the rainy season, and it's very easy to catch these small fish, and they just basically will throw a net in anywhere, not necessarily in a pond, and just collect the small fish. And because they're more abundant in the rainy season, they eat more of that. So we found that. And then in the dry season, most households said that they ate the larger fish, and they did that because often there was less fish available, and because of the cost of the large fish is lower. So in the dry seasons when they're eating fish, that's what they eat. So that's one thing we found, which we weren't anticipating this, and this is something that they'd found before. There's about a 20% seasonal difference in consumption. You'd be amazed at how much fish people in Bangladesh eat. In Sunamganj, which is the Hawa area, people are eating fish every day of the week, and they're eating it 3 times a day. In the rainy season, and then during the dry season, in that area, they were saying they were eating fish 5 times a day. And then in the 2 other areas, it was sort of coming down to about 3 to 4 days a week compared to 5 to 7, which is quite a lot. And even when they're eating fish more than once a day, people will cook it for breakfast and then have it for lunch, or they'll cook it for lunch and then have it for dinner as well. So it's sort of, when you come from a culture where you have something different for every meal, it was quite interesting for us to discover that people were really eating fish multiple times a day, and that we considered that, when we spoke to some people, we'd considered that actually that might mean that people are underestimating how much fish is being eaten because of the way that survey data is sometimes collected. So that was quite interesting. And we were happy to find that this sort of seasonal variation was supported in the quantitative data that we collected, so that was good. There had been a general increase across the board in terms of fish consumption because people had these improved practices, and they were certainly eating more of the small fish, and they were all very excited to be eating this. Seasonal occupation changed the way people ate fish. I know that I'm talking a lot about fish, and also vegetables. So in the dry period in April and May, when there's no rain and the waters are quite low, this is when people plant paddy, and the men are so occupied with doing that they don't have time to just go and take fish from the pond or from the Hawa. So at that sort of a time where people, was almost like a lean period for these households because they were so focused on the agricultural activities that they didn't have time to just, go and take their normal activities to get fish. So, and it's also kind of a lean season for some vegetables then too. The household net ownership, we would have thought that all the households had a net because all the households had a pond, but that wasn't the case. And as female-headed households where the husband was often away for work, which is very common in Bangladesh, for a lot of migrant workers working in Dhaka or out of the country, the women aren't involved in fishing, so they were really reliant on the netting teams that I showed you the photo of before to come around and take fish from them. So we found that in female-headed households that the consumption was a lot lower, even if they had males sort of sons or nephews around helping them. Consumption changed like I said, with the variation, changed in terms of day of the week, but not the number of times per day. Fish is like a staple in Sunamganj. People eat fish more than they eat vegetables up there. They often eat more than they eat rice. So it's kind of an interesting, I don't really know if we decided you can't really be encouraging people to eat more fish when they're pretty much eating as much as you can anticipate. But it's, like the implications for, for the work for WorldFish was quite interesting to find out that this really is a staple food for these people. And when they do have a lack of fish, they make up the fish in the diet they just compensate with vegetables. They don't eat less, they just increase the vegetable intake. Or they eat dried fish, which is another really important food source in Bangladesh and quite rich in protein as well. So I showed you the netting teams. We were interested about how beliefs and patterns, affected people's, the consumption of the small fish. Small fish are the one thing about them is that they're very bony and you do eat them whole. And a lot of people worry that feeding these very small fish to small children is going to cause the children to have worms, or that the bones are going to pierce their stomach. They have, they have a lot of traditional ideas, which might not be totally wrong, about, the risk of feeding small fish to children, and also even eating it during pregnancy. So we wanted to know how the lead farmers had gone about, changing these beliefs and what people had done. So. We found that there's a slightly different pattern in the Hindu communities around the introduction of fish and then postpartum practices. It wasn't across the board, but there was a lot of instances. Hindu communities have a 6-month rice feeding ceremony around 6 months of age, which is sort of the first foods that the children are given. And oftentimes this was sort of delayed for no apparent reason to 8 months, maybe even later. And that obviously that was affecting the introduction of other solid foods or semi-solid foods, including fish. And that there was a few cases where families or communities had beliefs about not feeding fish to women for 45 days after giving birth because they thought that the small bones were going to go through the milk and into the baby. So this is just a lot of interesting things we found. And in talking to the participants, in the focus groups, they did sort of say that they had changed their beliefs, that they used to think this and now they didn't. So, I mean, it's interesting to find out these stuffs and understand that they really had been able to kind of shift their focus around like the way they fed their children. As I mentioned, the cooking demonstrations, they said that most people said that they'd seen them and that they'd used the recipe. I mean, I don't know how often they were doing it, but people often are used to cooking the same meals all the time. So it was quite interesting to see that they really had adopted this method. And when we asked women about, did you do this for the child? Have you used this recipe? They were very positive about the fact that they would learn that they could grind the fish or they could fry it quite a lot and then feed it to the child, and that was safe to give it. There was general sort of seemed to be improved knowledge. I mean, we didn't do a baseline, so I can't say that it was definitely because of the project, but there was a good awareness in the communities about good nutrition care, good nutritional practices during pregnancy and lactation for children and healthcare seeking behaviours. So it was really positive to see that people really knew. We weren't meeting people saying, oh, I've never heard that, I didn't know that. Everyone was very much aware of what the messages that we and other organisations had been contributing. We wanted to look at intra-household dynamics and personal preferences in determining dietary choices and how that relates to food consumption at a household and individual level. We were really interested to find out what goes on within a household in terms of intra-household food consumption. And unfortunately, we weren't able to get too much more detail than we already had. We did find that there was evidence that women take food last always in Bangladeshi households. It's like that in many places in the world. And that on the basis of that, compared with sort of consumption data, paired with sort of other people's research, it's sort of pretty clear that women are taking the least amount because they're serving themselves last, and they do preference the husbands and the children. It was interesting to know in terms of like how to decide what fish people were eating, that preference and what they liked wasn't really a big choice. I guess had thought that if you had a pond and you had access to 10 different types of fish, that you would just choose the one that you liked the most. But there was a slight difference, and that really wasn't the case. And there was a slight difference between males who decided that when they fished, they would pick what they wanted, and the wives who just stood inside and waited for the fish to be brought to them in terms of the preference, because they aren't the ones picking up the fish. So they didn't see that there was as much choice relating to preference and choosing what you wanted, which was given the dynamic of how the fish comes to the plate. was quite interesting. Small fish was given preference over large fish. And as I mentioned, the food distribution was unclear, but women always took the food last. Price was usually the most important factor when it came to purchasing fish. And what was interesting again is that people still buy fish. Even if they have a fish pond, they'll often just buy fish anyway. I mean, I can't overestimate how much fish is a really important role in the diet in Bangladesh, and people, they want to eat it, they want to talk to you about it, so it's quite interesting being there. And the women weren't in charge of buying the food at all. They often in places like Sunamganj, women hardly even left their communities to do any food purchasing. So it was all the men buying things, but the men and women agreed that the women had control in terms of what they were buying. As even if they weren't there physically in the market, they told their husbands what they wanted, and the husbands agreed that they listened to their wives, which was, when you look at in terms of like the mother being the person responsible for what's being eaten, not being the person in the market may have some implications for like the decision making. But it was positive to see that the men all agreed that they deferred to their wife for advice on that, which was good. So lastly, we looked at the introduction of fish to the diet and what determines its consumption. So we had semi-structured interviews that we conducted, and also this was paired with I worked with a research assistant who was doing a master's thesis, and she conducted separate interviews which went into detail about the introduction of fish to the diet. So as I mentioned, the nutrition counselling and advice that the women were given encouraged them that they could introduce fish to children from 7 months of age. So that as soon as children were being introduced to foods, that fish could be one of those foods. And as I mentioned earlier, there was at first a lot of reluctancy for women to feed small fish to children. And you can understand why there's a lot of bones. When we spoke to the women about it, they said that they knew that fish could be introduced from 7 months, so like they'd picked up the message. We didn't expect that they'd actually started doing it because it's a hard thing to change, and we just didn't anticipate that. A lot of women did say that they had now, because as I mentioned, we targeted we targeted households that had young children and also women who were pregnant, so they sort of came through and received this training along the way. And there was, our records sort of suggested that those had gone through, had been introduced to fish at a young age. There's an element to make us think that they were probably just telling us what we wanted to hear, because it is a big practice to change. But positively, the knowledge was there. And they did tell us that they were introducing children to fish from a young age. So, it sounds like a small thing to be worried about, but for us it was a really key part of the project, because fish can be such an important part of the diet, and especially in Bangladesh when there's not much other animal source foods going into the diet. If fish is getting eaten and it's this micronutrient-rich fish, that was a really positive thing for us. Again, we asked mothers about how they introduced it, and they talked about mashing it, taking the bones out, or giving bigger fish when they were younger, because there's less bones in the big fish. As I said, some mothers were still worried about the bones. But overall, it was quite positive that these mothers had sort of changed, or at least said that they changed what they were doing. We sort of came across a lot of other bits and pieces, as you can imagine, through the course of the research. I had assumed naively, again, that if you had fish to sell and you needed income, that that would be an income. But as I think I said at the start, most of the ponds in Bangladesh aren't used for commercial purposes. People will use them at sporadic points of the year if they have an unforeseen cost. So, if you have a medical expense, people will get a netting team, they'll take 10 kilos of carp out of the pond and they'll sell it. So the pond, in many ways, and this is some ongoing research that WorldFish is doing, acts as almost like a safety net in the community and for these households, that they have access to a resource that is there for them to eat, but then if they really need it at the end, they can get money out of it. And that they do reinvest the money into the ponds. All the males that we spoke to said that most of the proceeds from the sale that they might sell at the end of the season when the pond is emptying out, they'll reinvest back into that. As I said, the fish is often sold at specific times of the year to cover costs. And the Adivasi community, which was the indigenous community, they had a communal pond between them, and they didn't just take fish every day from their pond. They had pulled together as part of the project any of the sale that they were going to make was going to buy them extra land, because they were living on a very small plot of land. with one pond between them. So they were using that money. So again, that was a really positive outcome for them and for the project, that this very impoverished community were able to get something else. We did find some problems with like some of the training aspects because of the sort of dynamic between mothers and mothers-in-law in Bangladesh and South Asia in general. There was some elements where the mother-in-law would go to the training and not take the messages back to the community, to the household, and pass them on to the daughter, and vice versa. The daughter would go and not pass the message on to the mother-in-law. So that was something we found in Dinajpur. We met a whole group of women who basically just had sort of not really a lot of knowledge about what we told them. So that was quite interesting. And then we were able to kind of say, well, this is what we were encouraging them to do, and these are the messages. And I mean, they knew that there was a project going on, but they hadn't been involved in it. We looked at sort of some interesting things about women's empowerment. We used female lead farmers, particularly for the nutrition components. A lot of the farming lead farmers were males, or the fisheries lead farmers were males. And they were really, really proud to be part of the project. This is just something, like in Bangladesh, which is a conservative Muslim country, like being able to get women out, talking to people in the communities, they were really proud of it. A lot of women we met in Sunamganj said that they used to never go out of their house and they didn't feel comfortable talking to people. So it was a nice benefit of the project that these women had been encouraged to go out and to become a bit more empowered. We found that there wasn't a lot of engagement with women in the fishing, and that in the future for more WorldFish projects would likely have an impact on, gender components of the projects and what could be done. We talked about like getting nets for women or women-friendly nets. The only place that women did get involved was the Adivasi community, because all their male heads of households or the husbands were all away, like labouring somewhere else to earn money. So it wasn't that women couldn't do it. It was just that they traditionally, in most households, it's not a woman's industry. Every household we interviewed, with the exception of a few in Sunamganj, which is a very flooded area, so there's not a lot of space, had home gardens. And those home gardens provided a lot of vegetables, a very rich source of vitamin A is from the green leafy vegetables that the households grow. And we talked to them about how much time they tended in the garden, did that detract from childcare. And the women said that it was specifically their domain to control the gardens in most cases. And they didn't have any sale from them unless they had excess at the end of the season or at the end of a month. And that, I don't know. What was I going to say? Anyway, the vegetable gardens were an important source of nutrition for the household, and it was something that WorldFish sort of in the second half of the project started working with the households on as well, incorporating orange flesh sweet potato into the projects because they can be grown and they're a very rich source of vitamin A. As I said, women were universally involved in tending homestead gardens and small livestock, but they didn't have any engagement with the fisheries, and the men, the sort of field work, the agriculture, which the main source of income for most of the households was very much the males' work. Again, I mentioned I think the mother-in-law, daughter-in-law dynamic was one of the more interesting things we found out about. Am I going over time here? And the mothers-in-law have a really important role to play in terms of nutrition in the house, dictating who's going, what's happening, and seeking childcare. And we heard a lot of stories from the mothers-in-law about when they'd been pregnant, how their mothers-in-law had not let them eat anything for 10 days and they'd only been able to eat pepper. So these women were quite happy that things were going to change for the better, and they were very understanding that you should incorporate the good nutrition. And that we realised that the mothers-in-law, more than the fathers or the husbands, in fact, have a more important role to play in terms of the pregnant and lactating women accessing food, because they're the ones who are there. You can't tell a husband to give his wife more food, you need to tell the mother-in-law, was the message we got. As I said, everyone had a really good understanding of good source of vitamin A and iron in the diet. Program participants overall said they changed their habits and practices, and they definitely said that they were eating more small fish, which in the sort of the scheme of the project is the most important thing, and the fact that they were earning more money from the sale of the fish, because they were then encouraged to do that. There was a lot of organic adoption of the technology in the communities, which was quite interesting for us to find as well. We didn't target every household in a community, but there were obviously other households with ponds, and a lot of them had adopted this polyculture technique just from seeing their neighbours have such success, and you can get extra income from the sale of these small fish and these sorts of things as that happens sporadically throughout the year. And we found that the presence of other projects in the communities was interesting. That was sort of hard to, a few times we spoke to women and they were like, they thought that what we told them was one thing, but actually that came from another project. As we started talking to some people about, and they were talking about wash activities and building a road. And Bangladesh is a very big country. It's very crowded. Well, it's not a very big country. It's got a big population, and there's a lot of aid and development money going in there. So you'll go to a community, as I've got on the screen here, and we set up to do one thing, and there's a group across the road doing another. So, I mean, there's a lot of overlap, and I think that was something that we could keep in mind is to make sure you're working with the other organisations in the communities. So I won't talk about the Adivasis because I think I've run out of time. And yeah, these are summary findings, so I think I've sort of gone through all of that. But yeah, I mean, I guess the most interesting part for us was that the lead farmers were really effective in delivering them new messages. They were we found that they were the key in that and the dedication of the field staff. It was a really easy technology for people to uptake, so they were very happy to do it. It didn't require any more effort than they were really already putting in, and they could see the gain. And the fish was the people just loved it. They were happy to be eating it. It's a tasty fish. It's very popular, so it was kind of an easy sell to these communities. But we did find, as I mentioned, stuff about the better incorporation of women, the targeting of nutrition messaging, and making sure the delivery was consistent. And then, yeah, so that's all. That's probably, yeah, and some cute Bangladeshi kids. So, great.